You've probably heard of the word sciatica before. Maybe you even know somebody or you yourself have experienced this problem. Sciatica is a catch-all term that the medical world used to describe when you have numbness, tingling, shooting pain, burning pain that goes down the back of the leg. Typically, it's going to start low back or upper butt cheek, and it's going to travel down the hamstring. It can extend all the way down into the leg and lower foot, but usually it's going to stick mostly lower back all the way down, typically to the knee. Again, it can go further than that, but that's the most common. Some of the most common reasons include one or more disc herniations in the low back. Sometimes there's a muscle called your piriformis that goes right across that top of the nerve that can clamp down on it. Or you can have trauma, you can have spinal stenosis, which is what happens here, where there's just not enough space in that canal anymore. That's a common cause as well, typically in older population. But that nerve is about as thick as your pinky finger. It's actually the thickest nerve in the entire body, and it has a very important job. It's made up of multiple nerves that come off the spinal cord, combine together, and then go down the leg to power a lot of the muscles, sensory organs in the leg. Okay, so it has a very important job. Usually for sciatica, you need to take a multimodal approach to treat it because you have to take care of any of the issue that's coming from the low back, that muscle that's involved. Because people sit so much of the day now, unfortunately, it's becoming a more common issue where those muscles just clamp down on that back of the pelvis. We also want to address, is there anything downstream that's contributing to that issue? So you really have to treat the entire chain, and we do that with chiropractic care, decompression therapy, stretches and exercises, and sometimes we will co-manage this condition with either physical therapists, pain management, or other qualified providers. But that's a little bit about what sciatica is. It can be treated. It's not a fun issue to have, so if you or someone you know has sciatica, be sure to send them our way.